Today, we're answering a user question from Kelly who asks about elucidation of what we call nerve pain. So nerve pain is an umbrella pain that's also known as neuropathic pain. It's a condition that's extremely complicated, caused by nerve damage or dysfunction of the nervous system, and it can manifest in many ways, and it can come from many different sources. Among the symptoms include burning, shooting, stabbing sensations. Sometimes it can be accompanied by numbness and tingling, sensitivity to touch, and even some conditions like hair loss or differences in sensation within the skin itself, and muscle weakness as well. There are many different causes. This can range from causes along the tip of the nerve endings themselves, what we call peripheral neuropathy, which can happen in conditions such as diabetes. There's central neuropathic pain, which happens from injury to the brain or the spinal cord. In these kind of cases, the injury is deep within the nervous system, and these happen as a result of conditions such as strokes, spinal cord injury, and multiple sclerosis. Nerve root pain is probably the one that I see the most often as a neurosurgeon, and this is caused by irritation of the nerve root, most often from the nerves as they exit the spine, for example, in the case of a herniated disc. This is also one where we oftentimes, especially when it comes to extremity pain, have the best chances of helping surgically, because usually when you take off the offending compressive agent, the pain usually does get better. Pain improvement, particularly with extremity pain, can improve in as much as 80% of patients in these cases. Finally, it can happen from trauma or nerve injury or to the nerves themselves. An unusual stretch or transection of the nerve can cause neuropathic pain, as well as other medical conditions such as HIV, autoimmune disease, and some types of cancer. So given how broad the spectrum of nerve pain disorders are, it also makes sense that there are a variety of different treatments. This include medications such as pain relievers, opioids, NSAIDs, although opioids are generally avoided for long-term use because of the central nervous system effects and the respiratory effects and other side effects that go along with it. Antidepressants, anticonvulsants can often be used, as well as topical agents such as lidocaine. Physical therapy is obviously a mainstay. Lifestyle modifications such as weight loss and conditions such as myalgia paresthetica, which involves compression of the lateral femoral cutaneous nerve, which occurs in the proximal end of the leg. Oftentimes, this is caused by an overweight patient with a heavy pannus, and weight loss can significantly help this type of pain. Interventional procedures such as steroid injections can be useful as well. In very extremely refractory conditions, treatments such as nerve stimulation, spinal cord stimulation may work as well. And finally, surgical treatments, as I mentioned earlier, can be useful in cases of a compressive entity. So hopefully this summarized a general spectrum. I'm happy to go into any of these in more detail. Thank you.